It's Dr. Ronald Bush. I'm a vascular surgeon, and I work at Water's Edge Dermatology, one of the largest dermatology clinics in the nation. We have the opportunity to treat many patients with both spider veins and larger veins and also other venous conditions. And we have the opportunity to do a lot of research in our dermopathology lab. So today we're going to talk about some of the causes and the treatment of spider veins at the ankle, which is a very common complaint for patients presenting to the vein clinic. Now, as I mentioned before, one of the most common complaints that patients have is spider veins around the ankle. All spider veins are dilated intradermal veins. Most of these veins are caused by transmitted pressure from a deeper source, as we'll demonstrate later. Now, in this brief PowerPoint, we'll describe some of the common causes of spider veins, as well as how we treat them. Now, there are some spider veins that are not related to venous disease. However, we'll discuss this at a later time. Now, veins around the ankle, this is the saphenous. From the saphenous vein is large branches given off right here. And this actually forms a lot of the veins around the ankle. Associated with this branch, this is the saphenous, which also refluxes. And so we'll show you the clinical picture here in a minute. Now you can see all these veins. You can see there's a reticular vein right here that comes in that feeds this complex. It's right here. And so we're going to inject this as well as do the injections to the spider telangiectasia. But you can see right here, this is the vessel that feeds all this. No tumescent here because there's not enough skin to protect against little superficial necrosis, but should get a good result just from injection. I'm injecting, you can see the foam is clearing out this right here. So this actually is two different origins of vein. She has probably a foot perforator as well as the greater saphenous. Here's a foam in the varicoses up on top, and you can see now that foam is also in the greater saphenous vein. So it just proves the origin of this is the GSV. Now we bend the needle about a 45-degree angle. The little stick here, and we just cannulate the vein. Gently apply pressure to the plunger. You can see the vein clearing out. This is the foam going in. We find this to be the best technique for treating ankle veins because you get a better result, but no tumescent here. This is just foam sclerotherapy. We're going to do this one over here. This is 0.1% sotrodecal foam. You can use polydocanol if you do for polydocanol because of reasons for history of asthma, use 0.25. But you can see how nice this is. And using foam helps prevent the refilling as well. Now for post-care, we apply Dermica cream. This is an all-natural cream that we find is very helpful in reducing inflammation. It actually helps with the healing of the area and decreases the bruising. Also, it's a fairly good analgesic for the patient. It feels cool when they apply it. Mild compression is worn for about 3 days, and we see the patient in about 2 weeks. If there's any trapped blood, we express it at that time with a small needle. So this is also essential in getting good results early.